Okay, so I am live. I decided it's raining outside. I'm here in Houston, Texas, upstairs in my house. And I thought I would address a question and answer period today. So I am here to answer any questions that you guys might have regarding dentistry. I appreciate every one of you guys on my channel. And I know that this has been trying times, and it's really interesting because I get a lot of people telling me that now that masks are getting to where we don't have to wear them anymore, that people are really upset because now they have to show their smile and they're not happy with their smile. So if you guys have any questions for me, just feel free to ask. I have been practicing for around 30-something years here in Houston, and this is my only office. There are other dentists that kind of do what I do, but not really. About 80% of my practice comes from YouTube now and Instagram, so I really appreciate you guys. If you guys have any questions, please feel free to ask. A little something about myself. I grew up in College Station, Texas, which is outside of Houston, and I went to Texas A&M University. That's right, I am a Texas Aggie. And then I went to dental school here in Houston at the University of Texas Dental Branch, and I've been practicing in Houston ever since. I kind of have a passion for helping people, and I totally love cosmetic dentistry. That's kind of what makes me tick. I enjoy changing people's smiles, and we do a lot of procedures that many dentists don't do. I try to kind of like to be creative, and if you don't have a lot of money to spend, we can always do some bonding, just some whitening, tooth recontouring, gum recontouring. Those procedures are a little bit less than say your traditional veneers. So the traditional veneers, the difference between bonding and veneers is very simple. So bonding is a tooth-colored composite material that's actually applied to the tooth, a one-appointment procedure. We etch the tooth, and then we apply bonding agent. Then we simply sculpt the bonding material onto the tooth. So it is a 1-hour appointment usually. And hi Keisha, how are you? Thank you so much for coming in. I appreciate it. I try. I like doing the videos. They're really, really helpful, I think, for a lot of patients. So basically, I'm just talking about the difference between bonding and composite bonding and veneers. Veneers are actually a 2-appointment procedure where the veneer is actually made at the lab. It is a porcelain made out of lithium disilicate. So porcelain veneers and bonding are very separate. Bonding will stain and it can chip over time, whereas porcelain veneers basically really don't chip. They can chip, but the chances of them chipping frequently is not that great. And also, veneers just don't stain. So if you're going to do a veneer on just maybe 1 or 2 teeth, you want to make sure that you whiten your teeth first. Hi, Joe. How are you? You want to make sure that you whiten your teeth first, and then you do the veneer, because veneers don't change colors. So if you put a veneer in and then you decide that you want to whiten your teeth, you're kind of screwed. Bonding basically lasts about it can be anywhere from 5 to 7 years, and it will eventually stain. So it's really easy to return to the dental office and have them basically roughen it up and just reapply some bonding material, reglaze it, you can get it back to the way it looked before. Some of the bonding that we do is totally reversible, which is kind of cool, but basically cosmetic dentistry is like wearing fake eyelashes. You never take the eyelashes off once you get the eyelashes. So whenever patients come in for cosmetic dentistry, regardless of if it's bonding, snap-on smile, veneers, they really never want to go to the way their teeth were before. So if they have a snap-on smile, many patients will either transition into veneers or they will get another snap-on smile. Insurance good question, Keisha. Does dental insurance cover Snap-on Smile? No, because it is a cosmetic appliance. So unfortunately, it does not. But the difference between, like, say, Snap-on Smile and a removable appliance, like a partial if you have missing teeth, is the removable appliance covers the roof of your mouth, and people don't like that. A lot of them do, or they have those clasps. Snap-on Smile has no clasp, and it fits over all your teeth. So not only can it replace missing teeth, but it can also whiten your teeth. It can change the shape of your teeth. And it can create symmetry at the gums. So Snap-on Smile is a pretty cool procedure that we do. Hello there. What's the difference between composite veneers and porcelain? Okay, I just went over that. Oh, composite veneers. Great question. So composite veneers are a pressed composite, and we actually have a lab that can fabricate the composite veneer. But porcelain veneers are much more translucent. Porcelain is made out of a lithium disilicate. It is a much longer lasting material. It doesn't stain. It looks lifelike. So the difference between porcelain, think of porcelain as like your Mercedes or say your Bentley of the car industry versus say like driving I don't want to insult anybody, a Hyundai, I don't know. So composite veneers are made out of a composite material, which is sort of a putty-like material. And a lot of times we will do what we call injectable composites. So say you came in and you couldn't afford veneers, or you didn't want veneers. We'll take an impression of your mouth. We send it to a lab. The lab makes a template. And that template is like a clear plastic piece, and it's a mold of your existing teeth. And it's got little holes that are placed on the edges. So then you come back in, we place the template. So the lab has designed what the teeth should look like, and then they make an impression over that. Okay, so they've waxed up. We send a model of your teeth, they wax it up. They take an impression over that. The impression is sent back to us in the form of a template. And we place that over your existing teeth, and then we inject composite into the plastic template, and it molds and it forms your new composite veneer. So it's kind of a cool thing we do. They basically run half of what veneers. In our practice, our fee is $1,600 per veneer, but we use a really great lab. Make sure that your lab is a experienced cosmetic lab, because sometimes you can see people that have veneers and they look like crap basically. So I always say don't discount on dental work, heart surgery, and parachutes. Do not discount those, because yes, you do get what you pay for. A veneer is not just a veneer. Now, a lot of patients ask if we reduce the tooth in size. Basically now we do what we call minimal prep veneers. So we barely take enamel off. We take just a little bit off because we want to keep the tooth structure intact as much as possible. But you've got to take a little bit off, because if you don't, the veneer is going to be very bulky and it'll cause gum irritation and it won't look good. Dental bonding per tooth. So it depends. If we are going to just close the space between two teeth, we don't, if you've seen on my YouTube video, I do not put bonding over the entire tooth because it'll make the tooth look too big. I basically just put it on the side of each tooth that has the space, like a third, and we blend it in. That runs between $350 and $450 a tooth, depending on the size of the gap. For an entire tooth, it might run around $500 to $700. It really just depends on the size of the teeth, which is the more material and the more difficult. So hopefully that answers your question. I'm always curious why knowledge is power, why you picked that name for your YouTube handle. I think that's kind of cool. I always wonder why. Some people use their real names and some people don't. So I actually do take the time to respond to every single comment on my YouTube channel. People will ask me if I'm the one doing it, and I am. I actually I get some nasty comments too, but you know what? I always address them. So as you all know, I have a therapy dog in my office named Piper. And I had a lady from the UK respond just recently saying how disgusting it was to have a dog on a patient's lap, and that how could it be legal? Well, in the States, therapy dogs are actually known to help the patients with anxiety. They have them in the hospitals, blah, blah, blah. But I told the subscriber to do their research. And you know what? A lot of our patients do come in asking for my dog. If you don't want the dog in your damn lap, then the dog stays in the kitchen. Okay, it's just real simple. So no one's forcing my dog on them, but I just had to answer that. Vacation bullies. How does gum recession play a role in cosmetic dentistry? And thank you for your compliment. I try to be good at what I do. So gum recession is huge, and that is a great comment. Basically, when you look at a patient's smile, you notice two things. You notice three things. You notice the color, you notice if the teeth are symmetrical, and you also notice if the gums are symmetrical. So gum symmetry is super important. And if you've got recession on one tooth and not the other, it's going to make your teeth look out of balance. Now, if you have gum recession, a lot of times, if it's not major and the other gum is too short, we can use a laser, and the laser can actually remove some excess gum tissue. If you have gum recession in the back, a lot of times it's from your bite or from clenching. And so we recommend you wear a night guard. Sometimes you can do a gingival graft. A periodontist will actually take tissue from the roof of your mouth and apply it to recessed area. So they used to think that gum recession was caused from brushing too hard, but it's not. It's caused from, most of the time it's caused from clenching and grinding. So we do recommend night guards, and that can help with recession a lot. It can help prevent, it won't bring your gum tissue back. You can reach my office. I think I put on my YouTube channel. You can go to my website, which is TexasToothLady.com, or you can actually call my office. At my website, it has my office number, and the phone number is 713-621-5141. So basically, you can go online and just check out. And my staff is super helpful. We have a lot of fun. Just got on TikTok. Have done a few TikTok videos, but I ain't got time for all that stuff. And I'm not a great dancer, but I love all the videos and I watch them. I know there's the dentist that's very popular. So we just have fun because I like to dance. So dental insurance would fully cover all dental procedures. Everyone isn't financially secure to pay. Exactly. Unfortunately, dental insurance does not consider cosmetic essential. So I guess they believe that if a patient wants cosmetic, then that is not an essential procedure. But dental insurance doesn't cover certain things as well. I'm not a big fan of insurance because I think they screw people over, but at least you have it. But yes, some policies pay more than others. Some pay at 80%, some pay at 50%. So it really depends on the agreement between you and your employer, the company you work with. But yes, I do wish insurance would cover more. And especially, I wish they'd pay 100% of cosmetic because I think it's important. Let's see. Hello, Notorious. How are you? The best dental insurance. I'll tell you what the worst ones are. Hang on, I gotta have a drink. No alcohol in this. It's actually ice water. I like those drinks. Basically, the best insurance will be any insurance where you're able to go to the dentist of your choice. I'm not really in network with any insurances. I do take Delta. They don't always pay. They have a low reimbursement as well, but stay away from the insurances that force you to go to a specific provider because you really do get what you pay for. Am I married? No, I'm not. I'm not married. I was married, probably like half of you guys out there, but I am not married. So that's cute. Thank you. Oh, when are we going to get married? Well, Notorious, it depends on how old you are. Is it possible to eat raw, pure, and explosive? What? Okay. Thoughts on people traveling overseas for veneers? No. No, do not. Like I said, do not discount dental work, parachutes, and heart surgery. Here's what happens. I think the people in the States, we are so much more experienced. And even if they're experienced, their lab might not be as good. But here's the problem. If you have a problem with the veneer, then you can't get it fixed because then you got to fly back down, right? But we see quite a few people that have gone for dental tourism with veneers and they look awful, like awful. So basically, my dental lab is down the street from my office. And so when we have the patient come back in to put the veneers in place, they actually go to the lab and we tweak and we will go back and forth for maybe a couple of times until they're perfect. So I am against going overseas for dental work, basically because the follow-up is so expensive. And I'll share something with you. There's a dentist in Miami that does a lot of bonding. You guys might know who it is. I don't know his name. And there's patients that travel to have it done, but guess who gets to see them all when they come back? Me, because they've chipped. And the patients come in and they're upset because now they have to pay me to fix them. Whereas if they had gone locally, then it would be much more advantageous. Can you eat? Come on, Joe's Caliber, whatever the hell your name is. Get real. Okay. $4,800 for 20 composite veneers in Colombia. That dentist does good work. I've seen it. He does do good work. And that's actually a great price. So there's a guy in Miami too. There's a guy in Miami that does the composite veneers. They do great work. And then I tell you what, if you live in Houston, that you can come in and I'll repair some of the, when they get chipped. But those dentists actually do decent work. Okay, I don't know how you're going to get real, buddy. I have no idea. Anyway, this is Q&A with me. I know a lot of people ask about affordable cosmetic dentistry. Veneers are difficult to discount because there's so much that goes into the veneer. The lab is very expensive. The procedure is expensive. The materials we use in the office. I got a question for you guys. How much do you think that we pay for a box of gloves now? Just a box of gloves. And how much do you think a handpiece cost? You guys would be surprised at how expensive dentistry, how the supplies have gotten. And we've had a difficult time maintaining like our mask, our gloves, all of that, because there's a big shortage. Best barbecue spot in Texas. Oh my God, there's so many of them. You know what? I don't eat barbecue. If I did, I wouldn't look like this. I really try to watch my weight. I work out a lot, but there's so many good barbecue places in Texas. I just don't eat barbecue that much anymore. Okay, this guy is crazy on here. So basically, as far as cosmetic dentistry goes, the guy, like I said, in Colombia, I'm going to be honest, Colombia and Miami, those two doctors do good work. But again, you've got to make sure that you find a dentist locally to repair, because sometimes they will chip. And a lot of them, they're just super, super, super white. New Orleans. Oh, you live in New Orleans. I've been to New Orleans. I like New Orleans. I used to go party there when I was in college. We had a lot of fun. I don't know what it's like now as far as with Louisiana's with the COVID and all of that. I've got two dogs behind me. I'm a dog person. So anyways, the other things would be how often should you get your teeth cleaned. Some people will go twice a year. Some people need to go every 3 months. It just depends. I know there's that big tartar video on my channel that's getting ready to reach 2 million views, which is pretty amazing. And I took that video. I don't know if you guys have seen it, but I took that video because I had never seen tartar quite like that. And I got a lot of interesting comments. But basically, if you get your teeth cleaned at least twice a year, you should be okay. You definitely want to be able to prevent gum disease so you don't lose your teeth when you get older. If you've got high blood pressure or anything like that, it can cause bone loss. It can cause tooth loss. And basically, do you guys have any other questions? Lakeem, how you doing? Yes, hopefully you'll come in to see me. Oh, so Keisha, you do have Delta. Yeah, Delta is actually a decent insurance and we do accept it. But you know, so we charge $1,600. So for a crown, we charge $1,200 and they reimburse us at $800 and we have to accept that fee, which is okay. You know, as long as these people can get their dental work done, then we're good with that. I've been vaccinated. I don't know how many of you guys have been vaccinated, but I have been vaccinated. In fact, my entire office has been vaccinated. We're still getting patients that, a little bit fearful, but I think COVID hopefully is behind us and we can all just carry on and live a normal life. I'm hoping so. We've got special filtrations in our systems in our office, and we basically treat every patient like they're dying, and that way, or that they had some dangerous disease. That way we keep everything real. Veneers or implants? Okay, so veneers and implants are totally different. Veneers are for when you have your existing teeth and you want to change the way they look cosmetically. Implants are when you have a missing tooth. You don't put a veneer over an implant, you put a crown over an implant. So you have a missing tooth, I would recommend an implant. And make sure if you get the implant, you go to a general dentist first, so they're the gatekeeper, and then the general dentist will guide you to use their team. So I refer to a periodontist, an oral surgeon, and I will guide you. So I am the gatekeeper to make sure that the results are exactly what you want. What made me choose dentistry? Seriously, my father. My father told me to go be a dentist. I wanted to be a trauma surgeon. I wanted to be a doctor, and I didn't get into medical school. I got on the alternate list, so I ended up going to Texas A&M. I was getting my master's in civil engineering, and I was in my second year as an environmental engineer. I was going to be one of the first environmental engineers in the country. And my second year, my dad said, go to dental school. And I told him I did not want to suck spit for a living. And here I am 30-something years later. So it is a great profession. He told me that I would be able to support myself, have a family, have great hours, and, do my artistic side with cosmetic. And he was right. So that's why I chose dentistry. Which is more aesthetic, okay, Shanti, and durable, bonding, crowns, or veneers? Excellent question. So between bonding and veneers, definitely veneers. They're much longer lasting. I have patients that have had their veneers in for 30 years. In fact, my 2 kids have veneers for different reasons, but they have veneers. As far as crowns are used when there's a lot of tooth structure missing. So crowns will last a long time and can be aesthetic. Sometimes, if we're doing a cosmetic case in the front, we'll actually mix up crowns and veneers, and they're the same material. They'll be the same material, which is the lithium disilicate Emax, and so we get great results. Let's see. Do I offer bonding for a side gap? Absolutely, I do. You can go to the channel, and it will show you a couple of videos and how we do it. So definitely, I do it. Yes, I should have a contest twice a year. Recommend me. Tell me what you think I should do. I would love to do that. MetLife Dental. Yes, we do take MetLife Dental, but if you're in network, I might not be in network with MetLife Dental, which means I have to sign a contract. I do accept all insurances, but I'm not in contract with any of them. So you've got, basically, if you live in Houston and you want to come see me, call the office. The girls would be glad to verify your insurance for you. And then we'll call you and let you know if you can come see us. A consultation, $40. That's it. We charge $40 for a consultation. And I'll tell you why. I keep it low because I want people to be able to come in and see me. Now, if you need x-rays, we do charge for those, right? And of course, procedures, but for the consultation, it is $40. That's it. Can you be a moderator? Someone is spamming weird things. Yeah, they are, right? That's that goofball. I'd say just blow him off. Free makeover smile for someone who can't afford it. Yeah, that's a good one. I do a lot of free dentistry in my office. I don't through the YouTube channel, but I do it in my office. I do a lot for on the news channel. So channel 2 here, I've done quite a few smile makeovers for channel 2. That's a great question, Letitia. I would love to be able to do consultations through Zoom, but in the state of Texas, it's illegal. Can you believe that? The Texas State Dental Board does not allow dentists in our state to do virtual consultations. Go figure. So I basically kind of do them free. So you can go to my email at drterrialani@atd.net, and you can send a picture, and I'll be glad to look at it and let you know what I think, as much as I can possibly see from a picture. So I just do that free. Hello, Jella. How are you? I don't know if I'm saying the name right, but good evening to you as well. We've got a lot of people on here. Yeah, the guy that's spamming weird things, I say just, you know, I don't know how to delete the dude, or I would, right? Let me see if I can delete this guy. Nah. Okay. Oh, my favorite sports car. I think I like the Maserati. And I like the new BMW, the convertible. Those are my favorite sports cars, but I don't drive those. But I do have a convertible, but it's an Audi. So what else? Let's see. No, I'm keeping politics out of it, even though I do side with you. You know who you are. I totally get it. Let's see. Thoughts on crypto investing. Oh, so here's my crypto story. I invested in Litecoin about 5 years ago, lost my ass, and it's gone way back up. So right now I'm making money. So I did invest in crypto, and I'm keeping it in there. I'm not in Bitcoin. You know, I still think it's very risky, but I think it is the trend of the future. So I don't know what that has to do with dentistry, but I definitely have invested. So any other dental questions? I'm going to sign off here in a second. Is there anyone else that has any other interesting dental questions, something you want me to talk about? I'd be glad to. Texas is not expensive to live. In fact, everybody from New York and California is moving here because we are the best state. We're a right to work state. Housing is inexpensive. Of course, if you can handle mosquitoes as a state bird, then you can live in Houston. We have a lot of mosquitoes. But we also have a cost of living is very cheap. And I'm close to 2 airports, so can drive or go to the airports and get the hell out of here as much as possible. What else did I want to talk to you guys about? Just there's so much. We do a lot of laser dentistry in my office, which is kind of the wave of the future. Thank you, Letitia. You have an amazing channel. Keep up the good work. The next time in Houston, you'll come in for the $40 consultation. There you go. Vacation, you're welcome. Thank you, thank you, thank you. So laser dentistry, there is a lot you can do with laser dentistry. And if you've got like an ulcer on your mouth, we can take care of it with the laser and it won't come back in the same area. If you have sores in your mouth after this ulcers, the laser will take care of it. So we do a lot of dentistry with lasers. Will Snap-on Smile improve to look even more realistic? So some of my Snap-on Smiles look like veneers. I kid you not. The ones that I've put on recently, they're just getting better and better. Now, the thing with Snap-on Smiles is it's case selection, okay? So if you have a patient that comes in and they have really large teeth, not a good candidate. The best Snap-on Smile candidates are the patients with smaller teeth. We get some kick butt results. And yes, they are looking more and more realistic. But like I said, case selection is everything. So we probably approve about 70% of the patients that come in that want Snap-on Smile. The others, unfortunately, we have to turn them away and suggest something else. So case selection is the most important. Let's see. The most shocking neglect case you've seen, how often should we clean our tongue? You know, there's tongue scrapers. I don't clean my tongue every day, but you can clean your tongue with a tongue scraper, especially if you've got a lot of filaments on your tongue. Some people have what they call a hairy tongue. So they have to clean their tongue much more frequently. I don't have that, so I don't clean my tongue. But the most difficult case, we see a lot of difficult cases, like a lot. I had one lady from Africa that came in and her front teeth were basically sticking straight out. Her front teeth straight out. She needed to have them all out, but she didn't want them out. But that was probably the most bizarre thing I've ever seen. Plus, the video that's on my channel with the tartar, that was the most incredible amount of tartar I've ever seen on a human being. So we see all kinds of crazy things because of my channel that people come in from all over. And let me see what else. Any other questions? I think that is it. Okay, guys, I'm going to sign off. You guys have a great Sunday. God bless. And see you on the next video. Thanks for watching. Thanks for tuning in. Bye.